My name is Alexandra Zubowicz, and I'm a general and bariatric surgeon at Fauquier Hospital. My training was in general surgery. I trained in Washington, D.C. at the MedStar Georgetown program. After that, I stayed on as faculty and am now a fellow of the American Society of Metabolic and Bariatric Surgery. At this point in my training and career, I've probably done close to 1,000 bariatric procedures. The greatest benefit of bariatric surgery to patients is that they can get their life back. Patients come to me after they've lost the weight and tell me that they can run with their grandchild for the first time in years, or that they can finally go to the gym again and feel good about it, or the chronic pain that they were having is completely gone. When people say that weight loss surgery is the easy way out, it's clear to me that they don't know a lot about bariatric surgery. It's true that my part is easy. The surgery itself takes about an hour, but the success comes from all the work that the patient puts in to make those major lifestyle changes and increase their exercise and physical activity. So it's actually tremendously hard work, but hard work that's very rewarding for them. Patients typically see weight loss after bariatric surgery almost immediately. A lot of times they'll be on a preoperative diet, so they actually start losing weight even before they get the surgery. But within 2 weeks of surgery, they're starting to see the numbers drop off quite rapidly. The process to getting bariatric surgery for the patient usually involves a 3 or 6 month preoperative program, then the surgery, and then obviously the recovery afterwards. Sometimes patients think it's a long time. They come in and just want to have surgery the next day, but it's important to do that process so they have all the tools necessary to be as successful as possible after the surgery. I'd say the most challenging aspect for bariatric patients is just getting them over the fear of bariatric surgery. 20 plus years ago, bariatric surgery was a lot riskier and some of those stigmas still exist. People don't realize that nowadays the surgery itself takes about an hour and you can go home the next day. I chose Fauquier Hospital because when I interviewed, I was very impressed by the professionalism and kindness of the people I met within the hospital system. Fauquier Hospital appeared to me to be a very high-functioning hospital, as one would expect, right outside our nation's capital, but at the same time had a small town feel, and people seemed to really care about patients on an individual basis as opposed to a giant managed care setting.